On the very end of our DAS, is that what this would be referred to, is Cindy Gillespie. She leads the health insurance exchange practice at McKenna Long and Aldridge. Her inauguration into the world of health insurance exchanges began in Massachusetts, where, as counsel to Governor Mitt Romney, she led the governor's health reform initiative. Since 2008, she's been working with both public and private clients, helping them to develop effective strategies for success in both the public and private exchange environments. So Cindy, from an employee's standpoint, when are these Affordable Care Act exchanges more attractive than their employer's insurance?
Okay. John, thanks. You know, there's been a lot of discussion today, some really great presentations, talking around the issues around the employer mandate, all those choices, et cetera. I want to show you a slide that we did, just because I think one of the hardest things sometimes for people to really get their arms around is this tax credit that's sitting out there. I mean, at the end of the day, the exchanges the Affordable Care Act created, in my mind, mostly exist to administer a tax credit. They're mostly attractive if you can get a tax credit through them, right? But what not many understand is how that tax credit is theoretically supposed to work next year. Well, I say theoretically because we all know there are a lot of issues. The law sets the tax credit as basically this way: the employee, or the consumer, the purchaser, is subsidized so that they only pay a maximum amount of their household income, right? There's not a set amount that they get. There's a set amount that they can actually have to pay out for their premiums. So if you take a look at it, this is just, we thought the simplest way to show it was just to put it together like this. Look at the 133 to 150% of FPL, all right? That's in about half the states. That's where the exchanges start selling. So the law says the most that the person can pay is, you know, at the lower end of that, it's 3% of your household income, right? Other than that, whatever the product costs, the government will subsidize. So your maximum payment ends up over there as monthly premium of $38 a month, right? All right, so the way they do this then is the person's premium subsidy is then pegged to what is the cost of the second lowest cost silver plan that would be sold to that consumer. So fine, the second lowest cost, the most I can pay if I'm making $15,282 a year. The most I can pay a month is $38 a month, great. What if I buy the first lowest cost plan? Yeah, then I don't have to pay $38 a month. If it happens that that one is, you know, $8 cheaper, I pay $30. Okay, fine. What if I buy bronze? What if the bronze one is $50 a month cheaper? Whatever, right? What it turns out is you can go down to zero. You don't ever get money back, right? But it's all set to drive that consumer at the low end of the income ladder, which is who is in the public exchange, towards the lowest premium payments. Because the lower they go, the more the government is subsidizing for them and the less their out-of-pocket is. So when you understand that about the way it works, one of the things you start to understand then is some of the impact it will have on employees that are at the lower end of the income ladder. Because frankly, these are very low monthly premium payments when you start to look at it like that, at the low end of the income ladder. All right, so this is just a simple example. And on purpose, we picked something kind of in the middle. All right, you have an employee, family of 4, household income, $47,000. First thing they could do, obviously, is drop coverage. We had a little bit of a discussion about this earlier today, I think. I mean, they don't want to be uninsured. This is not, for most, particularly a family, a realistic option, right? They're not going to choose this. But let's say they did. There's a maximum $285 penalty that this family could pay in 2014. All right. Otherwise, they can stay with their employer's coverage. It's, you know, when you calculate it all in, they're paying out, let's just say with the average 70%, they're paying $3,600 in premium costs. Fine. If the employee, they can look at other options. They're clearly not going to go buy in the outside market and use post-tax dollars. It would make no sense, right? If they were purchasing through the ACA exchange because their insurance was unaffordable or wasn't of minimum value, it would be $3,000 in terms of the cost for them, sitting at this income level. The lower the income, obviously, the less they'll be paying, and the greater the difference between what they can get through the exchange versus what they've got to pay by buying their employer's insurance. This becomes a bigger and bigger issue as you employ more and more lower income workers, right? Because they begin to learn. We talked about this a little bit earlier today. The bottom line is, it's not like in 2014 or even 2015, most people will sit around and calculate this out. But over time, at the lower end of the income ladder, if this all continues, they will begin to look around and find out from their neighbor that their neighbor was only paying, well, $10 a month or nothing or whatever. And they can't get it because their employer is offering them affordable coverage. This is the little sort of push-pull, give and take that is going to go on over time and become much more of a driver, I think, around a lot of these creative ways that people are trying to figure out for how do the lower income wind up basically subsidized by the government through an exchange subsidy versus remaining on an employer plan. It gets very interesting. I've seen a company out in California that's actually modeling that now for employers, and one of the more interesting things is obviously when you get down to these very low income, they're very young. So it does take a lot out of your risk pool. So it's a complicated model for an employer to actually take a look through.